Bismillahirrahmanirrahim, and welcome to another Tabadlab Policy Roundtable. One of the most informative and interesting pieces of work that we've seen recently came from Rashid Mahmood Langreal, who wrote about containment strategies and suppression for COVID. And that helped trigger and consolidate a series of important pieces of work by SERP, by Maruf Sayed and Anam Malkani. Further thoughts from Haris Gazdar at the Collective for Social Science Research in Karachi. Prior to all this, Durre Nayab and Nadeem ul Haq had written about smart lockdowns for PIDE in volume 17 of the PIDE newsletter. And so over time, what has developed is a series of thought pieces, most using data, but others using common sense as well, that help us identify where Pakistan is in terms of what we have been calling the lockdown. My colleague Umar Nadeem at Tabadlab has put together an analysis not only of what has happened so far, but also a synthesis of the various works on this in Pakistan. And we're now at a stage 2 months after the initial lockdown began, to be able to look back and assess how well these strategies, suppression strategies, have worked or how well they have not worked, and what probably is likely to happen over the next few weeks, and what Pakistan might be able to do to prepare for what's coming. We're really privileged today to be joined by the authors of those important pieces of work, Rashid Mahmood Langreal, who is a legendary civil servant and a thought leader in every way. Dr. Durre Nayab from the Pakistan Institute for Development Economics, Haris Gazdar from the Collective for Social Science Research, Maruf Sayed from SERP, and perhaps, I think, vitally, Tania Drus, who is the Special Assistant to the Prime Minister for Digital Pakistan, and really kind of the leading light as far as consolidation of both strategy and digital is concerned within the federal government. Welcome to all of you, and thank you for joining us in this policy roundtable. Langreal Sahab, I thought we would start with you since the, frankly speaking, for someone like me, the longest and densest piece on this has been published by you. It's clear you and your colleagues have done a whole bunch of thinking about this. This paper was prepared maybe a week and a half ago, so maybe you want to talk us through how you put together the paper, what the core thesis was, how it's been received, and where we are today.
Paper is essentially based on 2-3 insights, one from behavioral science, one from epidemiology, and one actually from theory of networks. So there are 2 processes at play once an epidemic comes into play. One process is disease diffusion process. So disease diffusion process proceeds on human networks, and it uses human networks to move from one person to another and to another. And in classical, as you would see in graph theory, you have nodes and edges, and nodes are connected through edges to other nodes. So if you imagine neighborhoods and villages as those networks or sub-networks, you would see that there are certain number of individuals, a few individuals who are highly connected within the network and outside. But the large majority are actually who are not highly connected. They are connected only to a few other nodes. So this is a very important insight in terms of disease dissemination, as well as behavior modification that is required to kind of either stop or eliminate the disease in its tracks. Building on that, from the behavior science, I thought that if these sub-networks could be disconnected, you can actually save the sub-networks or networks which have not been yet infected from being infected. Secondly, one consequence of this thought is that at an earlier stage of the disease, or even in later stage of the disease, the incidence of disease would not be uniform. Because for disease to be uniform, these nodes or these human beings should have a random movement, actually an isotropic movement. So unless it is random, you cannot have equal incidence of disease. So if the disease incidence is differential, then you have to treat it differently. So if you treat it differently, you need to identify which neighborhoods or which households have disease incidence that we do not have. Now that begs the biggest question of how to determine that. So how to make it visible to the social planner, if we can use the word, that which parts of the country or which neighborhoods or which villages have the disease and which do not have. Now that's a costly and that's a huge challenging business in terms of how to conduct tests and how to identify which neighborhoods, which households, or which cities for that matter are infected and which are not. Now, because that exercise is huge, so the world has erred on the side of assuming all neighborhoods to be infected until proven otherwise. So even in Western countries, they have done this big one colossal mistake. So they did not start testing the asymptomatic. Now it's asymptomatic, now we all know, constitute something 30 to 35% of the total people infected. But actually, in terms of their infectious load, it's not 30, 35%, it is much more. Because people who are infected and they have people who have symptoms, they save others from them, and others also try to save themselves from them. But these asymptomatic people, they not only themselves are innocent, their environment is also innocent of any symptoms they have. So given that, their ability to infect their R0 is much higher than people who are symptomatic. So if you see the total infection load in a country, so you would say they contribute more than 50 to 60% of the total infections in the. So if you leave the asymptomatic outside your network and you continue to test symptomatic and trace only their contacts, which cannot be done very, very efficiently, at least in most of the cases, until you assume that you have this huge use for big data and people are really connected and smartphone user, and you have some kind of super state like China, where you can actually trace all the contacts of the people who met at anywhere to the persons who were symptomatic. So the only option that you're left is that unless you start testing the asymptomatic, you do not have any signals on which to decide what to do. So the problem with testing asymptomatic is even bigger because the load of testing goes so much up that then you have these two problems. One problem is that you will have testing kits which are in short in number. So that I think I try to address by kind of building upon what Germans had done, that is pool testing. And I'm sure now we are all familiar with it. Then I talk to people in Indus Hospital in Karachi and talk to SIMS people. I also talk to some people in KP, and KP is now full-fledged, they have gone for pool testing. So pool testing kind of increases your capacity by 6-fold, 10-fold, 15-fold, depending upon what kind of kit you are using. So that's a game changer. But the other problem is that even if kit is one, you need huge logistical exercise to have these teams that go to the villages and neighborhoods and, every 10th or every 16th household being sampled. So that's a huge logistical concern. So collecting samples still remains a daunting task, even if you do the pool sampling. For that, there are two ways to go about it. One is, building back on the original network theory. You have these people who are super connected, individuals within each neighborhood. So you don't need to go in initial phase to the entire neighborhood. So you can do what we can call stratified sampling or smart sampling. So in each village or neighborhood, you first target these 10, 20 people who are either social leader or political leader or those who run the grocery store, who run the mosque. So these are the people who meet most of the people in the community. So if there is a disease in the community, in all likelihood, these super connected individuals are these, what you can call these, we use this a power of degrees in network theory. So these people with higher degree of connectivity are more edges to the others. These are the ones who are most likely to have the disease. So if you can sample within this subcategory, you can actually identify neighborhoods and villages in which the disease has reached, that disease has not reached. And having decided on that, then you can have a differentiated response matrix. So if the disease load is really high, probably you'll need a curfew, you'll need to quarantine it from without and put a curfew inside. But if it's manageable, it's low, and its ability to infect others is low. You can even, there are numbers, how many cases in what kind of census block, etc. Those could be debated. But the essential idea is, depending upon the incidence of disease, you can decide the strategy you follow. So in typically using, say, the public safety alert system as you use it, Maruf has written that about in his paper too. So you can declare zones or neighborhoods as red, yellow, or for that matter, green. So my guess is in earlier stage of the disease. So if you look at Pakistan, and you define one neighborhood as 400 households or so, which is a big village. A 400 household is a very medium-sized village in Punjab and Sindh and in KP. And it's quite a neighborhood even in the urban area. So if you take that as one neighborhood, so you have 80,000 neighborhoods in the country right now, as we speak. Now, in these 80,000 neighborhoods, even if your disease load, as we are talking 18,000 to 20,000 and 100,000 people infected, or even 150,000 infected, because it is uneven, so large majority of neighborhoods are still without any infection. We just do not know which of those neighborhoods are which are without infection. So once you declare those neighborhoods as green and you connect them to each other, then you have this big area that is green and where you can run the economy with kind of minimum precautions like face masks and other things, and you open that part of the economy. And then there are others where you can have differentiated response, say where you are putting curfew. That would be really an area which has quite some households, not only contiguous households, but non-contiguous households where the disease is already there. And then if you declare some area red or yellow, that does not mean that it will remain red or yellow. So you put curfew for 14 days, then wait for another 14 days or so. And if no case is reported, it can change its color. So, then you also kind of incentivize the neighborhoods to move along the spectrum from red to green. So this problem of the minority deviation, which is a big problem in case of COVID because of exponential nature of the disease dissemination, that even if a small minority, deviates, it can cause big problem. So then you can put the social pressure of the majority over the minority because you're taking now one big neighborhood or zone as a category which has to be treated differently. So people would be interested to move from red to green, and in that larger majoritarian interest, they'll be putting even pressure on monitoring that, let me call delinquent minority that otherwise would not go by that. So that's the big idea. Then there are details, how many tests in how many neighborhoods, so what would be sampling number, we can always debate that. So that's not a big issue. But the idea is, if you open economy without massive testing, which identifies neighborhoods which are green, or if you open economy sector-wide, as probably has been announced, though probably not open yet, and then because sectors run across neighborhoods, across human networks. So unless a sector is one self-contained network, you cannot declare it open while the rest is closed, or, for that matter, because then you are providing this kind of infection highway to the virus through the neighborhoods, say from Karachi to Peshawar for some of the sectors. So your optimal strategy would be, and I think that is the point which is not coming across in terms of smart lockdown, that whether you can open sectors, yes, you can. There would be some sectors, say aviation, where the sector itself is so self-contained within some geographic zone that you can open that. But most of the sectors would run across neighborhoods and across zones. And so the rest is just terminology. You use district or union council, or you use, in Maruf's paper, it's least feasible area probably, or least smallest feasible area. So you can call whatever you. So essentially, human beings live in these networks, and there is aggregation of networks. And if you are able to disconnect those sub-networks, you can disconnect. So you start policing the virus or the neighborhoods with virus, rather than policing the entire country vis-a-vis that. So that's the only way.
I think that's a really.
I hope this summarizes, but if I have missed something, I have missed that.
No, I think it's a great summary, and of course we'll come back to this because that really, in a sense, you've summarized not just your paper but most of the themes of the discussion we'll have today. Dr. Durre Nayab, I wonder if maybe we could bring it to you. You've just published an op-ed today with your co-author, Dr. Nadeemul Haq at Pied, which in a sense, at least on the surface, seems to echo a lot of what Langrial Sahab has framed in terms of how intelligently we need to parse the notion or the concept of a lockdown. Do you think? I mean, I think that summary is great because there'll be small differences in people's approach, but essentially it breaks down the need to stratifiate and to look at things in terms of the way that the disease spreads rather than in terms of our own notions of what we need to do to suppress. So going from generic to specific. Do you think that we have the public sector and communications infrastructure today that could be deployed to align with the principles that Langrial Sahab has articulated? Or do you think that it's too fancy a framing? I know that people will have strong views on this, but I wanted you to start with this as to whether you think the capacity, structural, resource-wise, data-wise, is there to do what Rashid wants us to do?
That's a tough question to start with. I mean, we did our paper. It was a very short note, a bulletin basically, which we did more than 3 weeks back. The whole idea of smart lockdown was just emerging. And it's interesting that we also, I mean, we recommended an intermittent cyclic lockdown. And again, the time span we used was of 14 days, like Mr. Langrial. And we said that we were basically talking about industrial setup, that we can have labor working in groups for 14 days. And then after 3 days of work, they can go off and see if the infection develops, and they can return if they are fine. And if they are not, they can stay away, get well, and then return. But since then, I feel even that simple idea is not exactly very practical the way we are operating. I mean, if I look at how the lockdown is working right now, anything that is not a complete lockdown is being called a smart lockdown. It's not so. It's definitely not so. And there should not be a consensus definition of a lockdown, a smart lockdown, because every situation needs its own version of a smart lockdown, adapted, localized, contextualized according to the situation. Right now, the kind of lockdown, the smart lockdown we are talking about, I'm sorry, I would call it rather a Russian roulette kind of a lockdown. We might survive, we might not survive, we might die, we might not die. Because, I mean, if I compare, I mean, for the last 2 months, I'm working from home, and I go out roughly after every 10 days. And after every 10 days, I've seen, I mean, right now, Pindi is like normal Pindi. A month or so back, even in stores, the trolleys, the handles were being sanitized, masks were being worn, sanitizer was given to even average shopper. It's not so. So, I mean, what Mr. Langrial is saying, it's perfectly fine, but how practical it is, I mean, even I won't even subscribe to the 14-day cyclic lockdown I talked about 3 weeks back. We have our limitations, and there is a lot of reasons for which it can't be implemented. I mean, I would say a lot of mixed signals and confused messaging is a big part. Why are people coming out on the roads? Because our messaging is becoming very, very confused. So, and there are, I mean, technology, yes, technology, Tanya, is not there probably anymore. For this whole thing to work, I think that technology can be the biggest aid. Tagging, tracing, testing, isolating. I think if we start doing that in a very, very efficient way, this thing can be managed. And now for me, if you ask me what is a smart lockdown for me, I think, go with something very, very basic now. Do you want me to say it right now, or, I mean, I would
Go ahead.
say, okay, I would say that we need to have very, very strict SOPs, which people need to know, and the SOPs that are practical. I was talking to an exporter in Sialkot, and he said that the SOPs we got are not exactly functional. We are being told that 20% of your staff can work. To start with, most of the even small scale enterprises, they do not get all their staff registered. So 20% of which staff, the actual staff or the registered staff. And they said, even if it's the actual staff, our assembly line is not complete if it's just 20% of the staff working. So to start with, the SOPs need to be practical, and they need to be very, very clearly spelled out, implemented, and monitored. I mean, just saying it that you have to do this, 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 and not monitoring it, it's not going to work. Then we have to work on non-pharma solutions. I mean, even in messaging, we are saying prevention is better than cure. For heaven's sake, there is no cure. Prevention is all we have right now. So again, this whole messaging is wrong. Tell people to keep social distances, and lives versus livelihood. No, it's not an option. Both are linked. Both are together. I mean, I was looking at when we started our PIKE bulletins, it was March 20th that our first bulletin came out. And it was about caring for the poor and the vulnerable. And it looked at vulnerable employment and poverty. It was lives and livelihood together. You cannot de-link one from the other. So this whole debate, even by looking at the smart lockdown, we have to keep those two things together. Testing, as Mr. Langreal said, it's very, very important. I mean, it is very, very important even if we have very strict lockdowns. Lockdown or no lockdown, smart lockdown or no smart lockdown, you just cannot move on without testing. Testing is the key. And if you look at the figures for Pakistan, you see very mixed results from different provinces even. An average life, the days spent in a hospital for somebody admitted and who passed away is just 3.7 days in Pakistan, as against more than 10 days elsewhere in basically developed countries. It shows that when even we are diagnosing a person with an infection, it is at a very, very later stage. That's why that person expires within 4 days, if that person expires. Otherwise, I mean, many get well as well. But this brief period in the hospital shows late detection. So testing is the key. Technology, as I've said, is very important. Like Mr. Langrial said, I mean, we need to identify hotspots. I mean, social distancing, yes, we have to do it. But what about those living in the slums, those living under the bridges? I mean, they do not have toilets, separate toilets. I mean, these are probably fancy things to say to them, that maintain distance. They do not have any distance to maintain. So in that case, technology can come in, identifying the hotspots so that more testing can be done there. I mean, you cannot test the whole city. You cannot test the whole country. Nobody can. I mean, none of the countries can, of course, we certainly can't. So technology can come in. And then clear messaging is very, very important. I mean, I'm sorry, but saying self-belief is the solution, no, it's not. I mean, you need self-belief, but it is not the only thing that's going to cure it.
So I think
it's not a problem of the elite. It affects everyone. And I mean, you need to tell people that there is going to be a second wave if you don't take care of it right now. It has a yo-yo effect. I mean, if you take precautions, it will go down. If you don't take precautions, it's going to go up again. We saw this in the Spanish flu. There was a second wave. And in the second wave, mainly it was the rich who were affected, because their immunity levels were even lower than the poor who were out during the first wave.
I think one of the important themes is communication, and I think there's various aspects to that. I want to park that part for a little bit later, and maybe just take the conversation to Maruf and see to what extent Maruf Saab, you agree with Durraiz, I think rather. Maybe saying dark is unfair, but certainly not a very optimistic view in terms of our capacity to align with the smartness. Your own paper, Maruf, also broke down it basically offered a policy matrix in which you could actually mix and match, much in the way that Langrial Saab has described. Could you just talk us through a little bit your approach, and again, your take on whether what you had proposed is realistically doable given the constraints of the environment?
Thank you, Musharraf, first of all, for convening such an important conversation and group. I think Langrial Saab started very concisely and really capturing the need for a smart or at least a graded approach. You look at the problem, quite frankly, I mean, let's be honest, right? We don't really fully understand transmission mechanisms today. We also don't fully understand what environmental triggers either suppress the virus or make it go completely loose in a population. So there is a lot of uncertainty. And in an uncertain environment, I mean, think of it as, you have a lot of fog. And when you have a fog, you don't just slam on the accelerator and go through it, right? You slow down, you look at, you use your senses and you look at what you have available today and constantly sort of collect new data or new information that can help you. And in our approach, it's exactly like that. We are basically saying, okay, look, you learn to act, but act to learn more as well, right? And this relationship between the two, certain actions don't require a lot of learning today. Like we all know that we need more tests. We all agree that we need more PPEs for our healthcare workers because they're at the front lines. But there are decisions that we need to understand. The devil is in the detail, right? When you look at sort of summary analysis Tabadlab ne jo produce kiya, you have incidence rates in a general population that are going to be very hard to capture with sort of random tests of general population. Now, we came up with this smart stratification of sampling, right? Langrial Saab also talked about, when you go local in an area, you don't just go and randomly, test random population, but you really think about network effects or, who could be at the front line. So we actually did that early on with FIA workers as well. When the disease was just starting to happen, we tested passport control officers in Karachi, Lahore, Islamabad, and we found actually 0% incidence of COVID-19. But you see that same population, you move it to healthcare workers, you see a much higher rate of incidence, right? So that population selection is very, very important. And to be learning constantly. So if you look at that, our sort of plan, it's very comprehensive. It talks about across those, graded approach, green to red, but more importantly, you have to look at the rows. And the rows are, you have smart testing and stratification of population. It starts to talk about sentinel surveillance, jisme, polio workers aa jate. I know Tanya and group have been working with polio workers very actively, but really deploying them and looking at sentinel surveillance, looking at traces of COVID in sewage water, right? That is, imagine it as a very, very high form of pool testing, if you will. Then moving to sort of, very targeted approach in terms of who do we deploy PCR testing to, who do we deploy amniotic tests, for example, developed by Yale, which is part of our consortium, by the way, which is, what can you do with saliva testing? So, and really going all the way to antigen testing. So as your population establishes herd immunity, you do antigen testing and be able to respond to it. Second is physical distancing. Hamari kafi is pe baat ho chuki hai. Third, which rightly pointed out, कि the community messaging बहुत important hai. And in addition to that, what we are calling it, sort of compassionate enforcement. Agar aap, you go and get an infected person and usko havalat le jate hain, ya usko, usko aur uski puri family ko kisi hospital le jate hain, it creates a sort of a adverse incentives for people to report their their disease and so on. So I think from really the community messaging should be more about self-efficacy, voluntary compliance. लेकिन एक policy हम बना देते हैं, एक हम announcement कर देते हैं, that's enough. But quite frankly, you have to also test that. You have to collect data on that. And that's where technology or CDR data or whatever tools you use is irrespective. But really understanding कि जी आपने एक policy announce की है, but उसकी compliance क्या है? Are you testing for that? Are you adjusting for that? So my main sort of point would be we have to really think about the devil is in the details. How to operationalize all of our plans. And quite, one thing I've also, learned is that across governments in Pakistan, there are really well-meaning people who are trying their best to implement and figure out what is the best way to create that balance between lives and livelihoods, right? And I agree that it's mutually exclusive, but rather कि इनको balance कैसे करना है और इसको एक localized manner में चाहे वो आप उसको zones कहें, circles कहें या आप उनको एक small area कहें, the real importance is how to do that sample stratification, how to create early warning systems so that कि जी general population में कैसे होगी incidence versus एक high risk population में. And then quite honestly, this is a dual shock. This is a demand shock and a supply shock. And we can come to it a bit later, but we have challenges in terms of large parts of the economy is informal. So when we're making decisions, the reason for collecting data is that we have some data that enables us to act, but for us to act precisely and to be able to really get the policies right, we have to continue to collect data from various different sources and then be able to inform our decisions to move forward.
Thanks, Maruf. I'll just quickly take this, to Haris. One of the things we haven't, so we've talked about the various approaches that need to be adopted. And really, I think at a strategic level, everybody, including all the governments, I think are on the same page. I think it's really at a tactical and operational level where the differences start emerging. One of the things that I found striking in your sort of invitation to think about this was to think not just from an analytical or a quantitative perspective with respect to containment and saving lives, which of course is incredibly important, is urgent, but also to think about what is informing, what values perhaps or what norms are informing the overarching approach. So actually at a strategic level to question what it is that interests us about COVID-19 and its threat and how we engage with it. Haris, I wonder if you might want to just expand on that a little bit further in light of the discussion about these various tactical, nuances as to how much of the debate do you think is focused on people, for example, and their well-being, and how much of the debate is focused on the vulnerability of people based on pre-existing, let's say, pre-morbidity factors?
I think that I found all of these contributions incredibly helpful, and I think that my intervention in this debate, I have some small work on the sideline around some operational issues, but my particular intervention in this debate is really driven by the following observation. It's something that I've read in Mr. Langreal's paper, in the SERP paper, in Dorian Ayab's paper, and basically everyone acknowledges the level of uncertainty and the level of kind of this fog that Maruf is talking about. So we actually don't know enough about how the disease will spread, and our knowledge improves over time as the disease also changes, and also our knowledge of its impact on economy and society. So we're basically facing multiple levels of uncertainty about basic information that we require in order to make critical decisions, right? So there's really no a dispute over the fact that we need to make decisions intelligently, right? So we need to look at the data, we need to look at our existing capacities, we need to look at, amazing stuff, right? If we had a very clear mapping of networks, we should use it. I mean, the tried and tested result in disaster studies is that if your systems, if your pre-existing systems work, you handle a disaster well. If your pre-existing systems do not work, you handle a disaster poorly. It applies to this particular disaster also. The problem is that once you have so much uncertainty about what the disease will entail, what its human impact will be in terms of lives threatened or lost, what its impact might be on the economy, you basically need, what you end up with in these situations of uncertainty is on things other than simple analytics to make decisions, right? And this is what we observe. It's basically a historical pattern. We make these decisions on the basis of values, on the basis of politics, of course, on the basis of our assessments of capacities, on the basis of what we think we can sell, right? So all of those factors come into play. And because there can be variations among decision makers with respect to each of these things and or any of them, you will definitely see very diverse perspectives, right? So for example, the estimates that I have seen pre-mitigation, right? So there was a study done by Brookings Institute that looked at the economic impact of the disease before there was a consensus globally on mitigation measures. And those numbers were frankly frightening, both in terms of lives lost, as well as on the impact on the economy. Now that's before the lockdown, right? Here we got a little bit confused because I think we locked down early, which is good, right? The Yale study shows that if you lock down early, then you've done a good job. But one of the implications of an early lockdown is that you are not taking the implications of the disease seriously enough, right? So countries have seen their hospitals overwhelmed, they've seen their graveyards overwhelmed, they've seen their communities overwhelmed. We have so far been saved. It might still be coming. So the morbidity and mortality aspects of the disease are not salient in the discussion. We talk about the costs of a lockdown, which I find a little bit myopic. I think that the lockdown is only one of the three factors that will impact on the economy. One is the disease itself, the mortality and the morbidity. The other is that regardless of what we did here, other countries are taking mitigation measures. Whether we agree with them or not, they're taking them, right? Which means that the global economy is locked down. The index of that is the oil price. There is no demand, there is no global demand. And here we have very strong lobbies that are asking for an opening up of the export sectors. Our export orders have been returned. I came to know of an export consignment which was returned mid-ocean, right? So we're making decisions on the basis of selective views on selective indicators, right? And I feel that that will happen, that is bound to happen. That's not a value judgment. I think that will always happen. Now the question is what kinds of selections do we make, right? What do we actually end up selecting? And what we end up selecting would often be driven by politics, would be driven by our interests, will be driven by our worldviews, and ultimately will be driven by our values. Now there's a very simple value. And that value is that, if we, regardless of most things, if we say that, look, we are going to elevate the saving of lives over other things, then many of the decision points become relatively simple to navigate. I don't think we're there yet. And I think that we might be there in a few weeks' time, unfortunately, when we see a lot more fatality. So in some ways, it's a game of learning. In some ways, it's a game of collective learning. In some ways, in terms of the entire elite will learn. Conspicuous events will happen. Some high-profile casualties will happen. And it will change the way that we look at the disease, we look at the science. So my view is that we need to pay attention to how decisions are taken. And of course, we all have our own views about those decisions being good or bad. But I think that these are the realities in which we live. These are the realities in which we live. Moreover, I think that what I like about what Maruf is saying, what Dure Nayab is saying, and what Langrial is saying, that basically be aware of be realistic about what you're going to do. Be realistic about what you can manage. And I think that Langrial is basically warning us that, he has a nice way of putting it. He's saying that, every society has its own carrying capacity of a lockdown. I think that's a useful way of thinking about it. But I think that every society also has different levels of capacity for doing things. And I think that, I mean, I hear these discussions, I'm like a fly on the wall when I hear law enforcement people discussing this. And they say that the more nuances you introduce, the costlier it becomes for us to enforce, and the poor the quality of enforcement is, right? So the push for a complete lockdown is coming from law enforcement. It's not coming so much from the health sector. Right? The health sector is saying it, and you can say, well, the health sector would say it, but actually, law enforcement is saying it. Why? Because they are aware of the capacities that law enforcement have. So we have the police, we have the rangers, and then we have the military ultimately, right? I think that all of us would agree in this room that let's save the military from this, right? We have we have a child in the room.
That's a good thing. That's not a bad thing.
Yeah,
having a child.
I think it's great.
That's hope, you know.
I think it's great that we're all getting to spend more time with our families and with our children. I mean, we'll come to this aspect of it a little bit later, but please.
My wife had warned me. She said that, you know, what's happening is that, you know, partners are walking through, and, you know, there was some Spanish expert or journalist and his mistress walked behind it. None of that, but my son. So I think that the capacity that we have, organizational capacity, a lot of the discussion that we are having around smart lockdowns, I think it's very useful discussion to have. I think, but it's basically telling us as to where we need to move in terms of our organizational capacities to deal with disasters. I think that at the moment, we actually do not have a lot of those capacities in hand. If we understand that this disease, you know, as Dore Nayab said, that, you know, this, if you take a historical precedent like the Spanish flu, the first, it started in January 1918. The first infection in Pakistan was in June, July. Mortalities began to happen in October and November of 1918. It carried on till 1920, right? This disease might also carry on in this way. So a lot of the discussions, a lot of the thoughts that we have at the moment in this room should guide us about the capacities we need to develop urgently in order to deal with this crisis as well as others. In terms of what we need to do practically on a day-to-day basis, I think that the capacity that I'm hearing about from, you know, people who have to enforce these things, they're saying that the more nuance you add, the bigger problems we have. They said we lose control over our people. As I said earlier, that I don't really want to see our armed forces involved in this. And the reason is that I don't want to see this spreading into our cantonments, right? I don't want to see my armed forces compromised. The police have to do this. The police are doing this. The police are saying that this is our capacity. These are the number of people we have. And this is the number of control we have over our own people. In a situation like Karachi, if you were going to shut down neighborhoods, one neighborhood and not the others, we actually have a historical precedent of that. We saw this in the 1990s when a political party did that in Karachi. It cost us thousands of lives. It cost us the economy of Karachi. It cost us massive amounts of political capital to get out of that, get out of gated communities. Our problem is that once we can shut down these communities, but we can only do it from the outside. And once we've done it, you can forget about the state going back in for the foreseeable future. So, you know, so the bigger political context, the bigger institutional context, we really cannot ignore that. And hence, we will have to decide, keeping a whole range of things in mind before we decide actually what actually is a smart thing. I want to say one final thing about what we can practically do immediately as of tomorrow. And, you know, one thing that concerns me greatly is that we still, you know, 2 months into our first case, we still don't have operationally agreed definitions of a suspected case in Pakistan. This is a scandal. Right? We don't have an operationally agreed definition of what a suspected case is. Tests are being carried out using multiple criteria. They're being triggered by multiple different criteria. There are forums that can resolve this issue, but they're not doing it yet. And we really hope that we take this issue seriously and did that. Thank you.
Thanks, Haris. That's, I think, a really great setup for Tanya. Madam, you are obviously sitting kind of at the nerve center in many ways of this whole debate and discourse. And you've heard a variety of views from really the top sort of, thinkers around this, people who've worked with the data. And there's also a continuum. So as Dure mentioned, the PIDE stuff was 3 weeks ago, and the most recent, thinking on this is from Haris himself, who just offers, a new lens or an additional lens, and maybe perhaps the most important lens. To what extent, maybe comment initially on what your take is on how much of this thinking, because we know, for example, that all 6 of us all 6 of us, I think we might have lost Tanya for a moment. So we'll just check on what part of the question she's been able to hear. But
my apologies, my laptop died, so I'm dialing in from my phone now. I missed the question, Musharraf. Do you mind repeating it?
Not at all. I love to repeat myself. And
yes, we know.
What I was saying was, you've heard these various, sort of both at a strategy level and at a tactical level. And I think the kind of the norm setting agenda that Haris is, in a sense, framed right at the end there is incredibly important as well. To what extent do you feel that a lot of this, so we know, for example, that Maruf, myself, Haris, Rashid, and Dure, all of us have engaged with provincial and federal government folks that have invited input. So we know that the government, as I think a couple of the speakers also said, there are various people and institutions within government, within the military, within civilian government, within the provinces, at the bureaucratic level, at the politician level, that are inviting input. But how much coherence is there at the end when it all comes together? Because there's a lot of coherence amongst the speakers here, right? You almost saw each one building on each other's thing. And so I'm presenting it to you now, and maybe you can talk a little bit about to the extent to which you think it comes together, whether it does at all, and what are the challenges in helping things come together for the top leadership in the country, and then maybe also comment on various aspects of what you've heard so far.
Yep. No, thank you, Musharraf. First of all, thank you to you and to Tabadlab for doing the roundtable, and also for inviting me and giving me an opportunity to present our views. Look, what's very interesting is at least 3 out of the 5 people on the call I've been in very deep discussion with on corona-related topics for the past many weeks now. And I'm actually very, very aligned with what most of the speakers have said so far. I think what the question you're asking is very pertinent in that there's been lots of information gathering and reaching out to experts, and almost on a daily basis at the NCOC, there are people coming in and experts coming in presenting the work that they've done, the research that they've done, and the smart lockdown has been a big topic of conversation for the last 2 weeks. Before that, it was testing and contact tracing and quarantining, and ultimately a lot of this comes down to execution. I don't think you will find anyone who disagrees on the notion or the concept of the importance of doing a smart lockdown. I think pretty much everybody that at least I have interacted with fully agrees that as a country, we took the decision to do sort of what you would call a hammer many weeks ago, because the data that we had at our hands was very limited, and that was the case pretty much world over. There were estimates coming out of all kinds of studies where, I remember the Imperial study back in the day was estimating, hundreds of thousands of deaths in Pakistan. And I think at the time, the best thing to do was to do a lockdown with the limited data that we had. And of course, over that period, I think across the board, we've gotten a much better handle on both collecting data on cases and on patients and from labs, increasing capacity, but also actually starting to get a better sense of what the disease and the spread of the disease in Pakistan specifically is like. And 2 months in, we're on day 65 or day 66 now since the first case, we have, what I feel, certainly far richer information on the disease than we did 6 weeks ago when we had to take some of these decisions. I think when we talk about a smart lockdown and you talk about how you implement it, and this has been a conversation I've had with Maruf and also with Rashid in detail, what does it take to actually put it in motion? What are the tools needed? What is the technology needed? It's certainly not only a technology problem. Technology is just an enabler. Ultimately, the enforcement of a smart lockdown has to go down to the district administration level. How do you communicate that to them in time where it's actually helpful to them? How do you define that area, whether it's a zone that, which Rashid calls out in his paper, or a circle, or a census block, or whatever you want to call it. But what is that sort of geography that you can actually physically go lockdown? And for those of us that are in Islamabad, we know that we've been hearing about this I-10 zones and I-10 lockdown over the past few days. How do you get to that exact area that needs to be locked down so that you're not just putting too many extra people in a lot of inconvenience or impacting the economy? And I think that that's where ultimately the rubber is hitting the road. And to be honest, a lot of the conversations I've been in recently have been, how do we put this in place so that it can actually be a useful tool for the provinces? Because ultimately that is where, the actual enforcement of the smart lockdown will happen. And I think in my humble opinion, I think we've made some progress on it over the last couple of weeks, and probably not as much as we would have liked. But I think part of it is just on a day-to-day basis, there is so much happening and so much sort of new stuff coming up and so many decisions that need to be made that often we find that it's actually quite hard to move from being reactive to thinking ahead. And I think this is something that clearly, I mean, I'm certainly facing this personally, but I see this across the board from a lot of my other colleagues in other countries that I talk to. I think, your question was, how do I see it playing out? I think the way I see the next few weeks playing out is that there are certain sets of decisions that need to be made. We have Eid coming up in 3 weeks. Eid is a very specific event that needs to be planned for because, we all know that there is large amounts of movement in terms of retail, in terms of interprovincial movement with people going home. We have to think about, what has to happen there. We also have to think about what is it. Now we've got a couple of weeks of data under our belt from having done what we call TTQ. How do you enhance it and how do you scale it? Because ultimately, as everyone has said, testing, not just general population testing, but also specific, very targeted testing is incredibly important to get ahead of this. And while our testing numbers have improved dramatically, we still have a long way to go. So the second piece is sort of how do you scale up the TTQ? And then the third piece is how do you build the systems that you need to build and get them in place so that you can actually do an effective sort of small zone, small block lockdown. And that's the piece that personally I'm spending a lot of my time on right now, thinking about, talking to a number of private sector players who may either have the right sources of data that are needed for us to actually understand population density in a block. Because again, a block or a certain geography is very different depending on where you are in the country. So that's the piece that I'm certainly spending a lot more time thinking about, and that's what I've been engaging with Rashid and Maruf on as well. So look, I mean, not perfect answers for a lot of these things. I can tell you that I'm sitting at the NCOC right now. I've been here since 10, and there is a desire to do the right thing, and knowing that these decisions are incredibly difficult, and it isn't just about the spread of the disease. It is also about the state of the economy. And whether you look at the study from Yale or you look at the Gallup polls that have recently been done, there is a very, very real cost to a country like us, and we're seeing that in motion every day. So tough decisions, tough times. I will say I feel very fortunate to be a a part of these conversations, and I can tell you that there is a lot of good desire, a lot of good action to try and get us to a point where we can get far smarter about making some of these decisions.
So, Tanya, you mentioned the I-10 thing, and, perhaps only because of relevance, because I live in Islamabad, and so do you. That's been kind of top of mind for us. You'll remember that the first fatality in the country was the Madan UC Manga case, and UC Manga was the first union council to be quote unquote locked down. I know there's a number of neighborhoods in Karachi where a similar thing was attempted. There were some complications there, I think, around communications. Before we get to the communications part, and I want to get everybody's take on that, and you may want to mute what you're hearing for that part of the conversation, Adam. But before we get there, I wanted to ask, to what extent have you, are you able to talk maybe a little bit about whether any learning from UC Manga, for example, was applied in the decisions for Islamabad, even if it wasn't conscious? So even if it wasn't the DC Islamabad, investing in that learning process, is the system helping information and lessons flow from point A to point B, both in terms of geography and the time and space continuum?
So look, I'll first off, I'll say I'm more than happy to keep my keep myself on and listen to whatever all of you have to say, just because I think that's the only way we can get feedback and try to aim to be slightly better. Here's what I'll say. Is it a perfect system of communication across UCs, districts, etc.? No, it isn't. But the opportunity we do get on a daily basis is this briefing that we do at 10 a.m. with the chief secretaries and the health secretaries and the health ministers of every province. Now, it doesn't obviously go down to the district level, but they are obviously, each of the provinces is doing daily, does daily meetings with their specific DCs, etc. So what we are, however, doing, which I think is working well from what I can tell, is that these things are being talked about daily there. And so, this isn't just the case of this smart lockdown. This is the case of how flights are being managed and how testing is being done for incoming passengers and sampling that's been, so there's been some provinces have started doing testing using random sampling. And it does become a forum where the provinces and all of us go back and forth and discuss a number of these things, which I do think create a little bit of a forum. To be honest, I haven't been in the government for very long, but I haven't seen this kind of sort of cross-pollination happening on a daily basis. So my hope is that, when a province is talking about something that has gone well, which by the way happens a lot, and also happens on the other side where something isn't going well, that the other provinces are taking note and then passing those messages down to their specific district administrators. So is it happening through some super systematic way? No, it isn't. But I do think there is sort of learning by osmosis happening because of these forums that are now set up daily.
So I think that's really helpful. I mean, and it's useful to, there is diffusion of knowledge. I wanted to bring the question to kind of the same question, maybe Langreal Saab. But before I did, I wanted to just post or present what we've sort of tentatively concluded or proposed, which is, I think in writing, at least 3 members of the conversation right now have said that the so-called smart lockdown is neither smart nor is it a lockdown, which is absolutely legit critique. But I think moreover, there's a problem with the terminology, because when we say lockdown Pakistan, we are essentially impinging on Pakistan, on the people of Pakistan, on their livelihoods, on their sense of well-being. I just wanted to, ask to what extent you might think that it may be useful for us to think about changing the terminology. So we've proposed locking out the virus, because actually the object of policy should be the problem, which is the virus, not the people. take this question to you, Langreal Saab, and I know you had something to say with respect to what Tanya had been saying as well.
So thank you very much. So, there are 2-3 points that I want to make. And essentially, time window is very important. So while we learn as we go, and we'll not refuse to learn, but if an action is delayed, it has huge exponential costs. So any relaxation of lockdown at this point, and some of it is happening already, and you have heard that today, that cannot be allowed till you have this confidence interval that there are certain areas where there's minimal or no virus. So anything, by redefining something as smart, it will not become smart. It will become smart once you have done 2-3 things. So you have done massive testing. You have done testing asymptomatic in a big way. You have done industrial scale contact tracing. And you have then put in a place system, which Maruf says graded system of response. Unless you have put it, we cannot start calling it by any other name, but as it is. Now, within the time window that we have, we need to ensure that till we have all of these things in place, we continue with a stricter regime of lockdown. And that is happening just across the border. And now, even in mortality data, that has started showing up. Because, your lockdown started on 23rd, 24th. And now, after 23, 24 days, your mortality data is also showing up. What is the effectiveness of the lockdown? So if you just compare it across the border, because their lockdown also started the same time, and they have not been relaxing it or kind of talking light about it. So, compared to what we have been doing. So, that is now showing up. So I think that could be very, very dangerous situation in which we could land. And I think Haras said it rightly, that our guards have been lowered because of relative earlier lockdown. And then, and this is that trough and peak model that I thought about behaviorally. When the danger is low, you automatically kind of relax. On the implementation capacity, there are many questions that have been, come to this discussion, and they have been discussed elsewhere. I tell you, trying to lock down entire country spreads your implementation capacity much more thinly than trying to test the country across, but lock down only specific areas. So actually, it's the case of having less enforcement capacity for a smarter lockdown, but more testing. And on testing, as Maruf has said, we can go various ways. One of the nicest news that is already in there and would reach is even in PCR testing mode, you will have self-swab capacity. Then you don't need to send these teams into the villages and neighborhoods. People can self-swab, and if one of you has gone through this Bill Gates paper, so he clearly talks about that the design thing is done, and design is being made simpler and cheaper. So then you can actually take your own swab from your nose and not going deep down the nose, and it's much easier way. And then you can collect any number of samples. And if you have the pool testing in the lab, which we have already proven, so your testing capacity can go 10, 15, 20-fold. Even with 10,000 kits, you can do 100,000 tests a day. So if you achieve that, you have actually mapped the country in terms of viral load. And now your enforcement capacity, the police and the army and other things that we are talking about, that is only needed in red and maybe somewhere in yellow zones. In green zones, you are basically saying that police should be up. Currently, we are spreading this capacity too thinly, the administrative capacity, the enforcement capacity, and actually the smart lockdown is a solution to the enforcement capacity, that we cannot hold our breath this long. As far as one point that, currently what we are doing is that wherever the disease, kind of sprouts its head, we go and try to, suppress that. This is very reactive. I've talked about elsewhere, it's like trying to fight Greek Hydra. You cut one head and two grow elsewhere. So, then Heracles' nephew came and he said, you have to cauterize the stumps. And unless you cauterize the stumps, that is the asymptomatic neighborhoods where there are, kind of hidden agents who are infecting people. That you can only do once you go for testing in neighborhoods where there is no case. And there could be multiple ways. You can go for self-swab and random testing. I have no doubt about that. But you can enter unless you have the self-swab. You can do this, super connected individuals, as Maruf said, the grocery stores and other places where people generally go. So I think it's fully implementable. So the total cost, the outer bound of the cost that I calculated for this basic testing is not more than 35 billion, but that is calculated without these, smarter self-swab, other things being done. So this cost would come significantly down as time passes on, and then you can have. On the other hand, when people think about that, how we'll make these zones or areas, these are already there. Census block is the unit on which, we make our constituencies, we make our election arrangement, people go and vote, and everybody's familiar with that. Census block is 100 to 150 households. So you have only to aggregate these census blocks, whether it is an urban area and rural area. Good news is that for urban area, your census block have all been GIS mapped. So they are already GIS mapped. So you don't have to really do even that aggregation again or do any big exercise. So there are existing data with Bureau of Statistics and with PITB and other boards that you can use, and like 4 or 5 days at district level using local information, you can build these, you can call it union council, use existing boundaries, but you have these zones or whatever you want to call it. That's not an issue. So at the local area. And you can have the system fully operational 15, 20 days, but you have to hold your breath for 15, 20 days. I tell you what, honestly, if we do relaxed lockdown or do any other kind of opening, we will go through a disaster that we haven't seen since 1918. And in 1918, between 15th of October and 8th of November, 8.82 million people died in Punjab. In Lahore, people wouldn't find wood for cremation. Just 21 days. So they say 5% of Punjab population went down, but at least 4% went down in these 3 weeks. So we might have forgotten that, but there are still some stories, and some families would tell you their grandmother's sister, actually fell to that. So God forbid that comes to us, but we should not relax, as Haris said, that because so far our numbers are good. Maybe there is an X factor, and I am hoping, I pray that there is an X factor. But you can't have your strategy an X factor. Your strategy can't be hope or X factor. Your strategy has to be worst case scenario. Whenever you're making a decision in uncertainty, you de-risk the decision. There are frameworks available for making decisions under uncertainty. De-risking is you prepare for the worst and then hope there is an X factor. And if that would be a great news.
So, Langrial Sahab, I've just shared a screen of just one of the slides of what my colleague Umar Nadeem has put together as an analysis. And you talked about relaxing the lockdown. If you look at the number of cases, and we've used a week-on-week daily average rather than a day-on-day daily average, simply because that it smooths out any outliers. You can clearly see 2 things that you can derive from this yellow headlined chart right in the middle here. The first is that around the time that we started locking down, so to speak, which was the middle of March, there is a decrease in the number of confirmed cases in terms of growth. And you also see that towards the middle of April, as the so-called relaxation. What's interesting about this relaxation?
2nd March, to be exact, when we announced the lockdown.
Right. So from the 22nd to about the middle of April, you essentially have got a situation in which there's now a rebound and a slight increase in the number of cases. Now, just very quickly, that increase has nothing to do with testing, in the sense that there has not been a decrease in testing. Throughout this period, the number of tests have increased. So the net, sort of conclusion is we don't need to wait for the impact of relaxation in any way, because we know what the impact is. We've seen that impact already. I wanted to take this to Haris for a second and just maybe ask him to comment on this communication issue, because at least to me, and maybe Dure will agree with this, but Haris, at least to me, this so-called relaxation is not a formal relaxation. It is a product of inconsistent and incoherent communication across the board. So not to pick on one party or one individual. Obviously, the top leader in the country has a greater responsibility, but there is a communication problem when it comes to suppression and containment measures, is there not?
Certainly, yes. I think that we're giving mixed messages. Let's just call it the state of Pakistan, which includes all of the governments, all of the institutions. I don't think everybody appears to be on the same page. They might be, but to the ordinary people, they don't appear to be on the same page. And I think that what that does is that in Pakistan, it triggers a lot of lobbying, frankly. So if you feel that there is some room to maneuver, then you start lobbying in Pakistan. That's what you do. And those lobbies become very strong and they start to mobilize opinion around themselves. And they basically develop a voice and they start probing. Now, the problem is that once you start probing our law enforcement can do one of two things, right? They can either stop enforcing or they can enforce in a very harsh way. And so far, I think that they have, I think there's been a very high level decision that do not be extremely harsh. So the harshest incident that I've heard of was when in some place there was aerial firing. But you know, really, I think so decision is taken that law enforcement will not actually enforce. And I think the reason is that they know that they can't. If you allow law enforcement to be tested to the limit and they fail, you can forget about a smart lockdown. You can forget about a phased lockdown. You can forget about anything else in the future. So that capacity, it's best not to test it right now. So I think that the outcome is that, you know, there's a huge dilution in effort.
Absolutely. And I also think this point that you made, I think it isn't being made enough and not well enough either. And that is that once you relax something or you allow a rollback of something, formally or informally, the next attempt to harden it and to enforce it is going to be doubly, triply, you know, we don't know what sort of, you know, quantum, but it'll be that much harder. Dure, what is the likelihood that we'll be able to revert to a harder version of a lockdown given the inconsistency on communication?
Well, Musharraf, if this, whatever we are calling it, a smart lockdown, if it doesn't work, then a complete lockdown would be the only option. Because I mean, there's as much as your health system can take. I mean, doctors are protesting everywhere. Even in that, politics was brought in that it's one province's doctors are being used to protest. Hi. I mean, like Piketty used a very good term. He said that for this whole lockdown business, we have to use words very, very carefully, and we have to give a notion of a social state instead of a prison state. I mean, why do we, when we say lockdown, it gives a very oppressive feel to it. If we are doing it, it's for the people. And I think the words we use, why am I going back to messaging a lot? Maybe because I think words are more potent than we think they are. So this whole idea of a lockdown should be used in a way that people realize that it's for their good. I mean, I was watching a German documentary and it said that Corona kills people and slow governments kill businesses. So the idea of being prompt is very important. Our rates remained low initially because we were prompt. Then the whole thing got messed up and a bit of politics and a bit of cryptic messages, mixed signals. And I'm scared. I mean, as of now, our mortality figures are not exactly impressive. People think that we won't have the numbers to be scared of. I just hope they remain that way, but it would be something that we should analyze 3 years from now, that why did we not have the kind of mortality that the European countries had. There's no scope for complacency right now. We cannot go complacent just because our numbers are not high as we see in other countries. But if they, I mean, for the past few days, we see that every day we see 1,000+ confirmed cases. And as I said, if I go out, I see fewer people wearing masks, more people on the streets with no precautions. So if this thing goes on, we will ultimately go back to a complete lockdown because there won't be any other option. And like I said, it would be a yo-yo thing, coming in, going out, coming in, going out, and it doesn't work. I mean, talking of economy, I mean, we have to worry about the economy, but of course, people have to be there. Economy is for the people. Economy, once this whole thing is resolved, we are doing estimates for the post-COVID scenario at PIDE right now. It's going to be a V-shaped recovery because there are not any structural damages to the economy. It's not like an earthquake came and everything got destroyed. So once the health aspect and the human aspect is sorted, economy would be back on track. So right now, a very clear-cut policy and very clear-cut messaging is required. Otherwise, I mean, we'll again go back to a complete lockdown, and I don't think our economy or the people are ready for it.
I really, I think that one of the things you said, I mean, a lot of it resonates, but one thing that particularly resonates is the idea of communicating effectively. And as I'd said at the outset, the notion of a lockdown, I agree with you entirely. The notion of a lockdown suggests impinging on the people, on the economy, on the country, whereas locking out the virus, which is what we've proposed, and there could be better proposals out there, but we really need to change the language. So rather than talking about a lockdown, we have to talk about locking out the virus, blocking out the virus, whatever it is. But the target of public policy needs to be the bad guy. And the bad guy isn't poor people looking for work. It isn't the government. It isn't Haris or Dure or Rashid or Maruf or Musharraf or Tanya. It's COVID-19. It's the virus. Maruf.
I mean, a bit of compassion in the whole idea, I think, is going to carry the message much more effectively than what we are doing right now.
Absolutely. And I think that there's a lot of good that the government can point to say and to offer demonstrable proof that there is an element of compassion, not an element, really overwhelming, loads of compassion in some of the things that the government has done, partially because it's driven by the Prime Minister himself. So I think there's ways to exploit, even from a political standpoint, but to exploit what's already there in service of better communication. Maruf, is that something that you see as realistic, given your kind of vast interactions with, I think now, if I'm not mistaken, every one of the 4 provincial governments and the federal government?
Yeah, Musharraf, I think we have interacted with many governments at this point, and I think the uncertainty and differential messaging is definitely a challenge. But the differential disease vectors are also, prompt them to perhaps message differently. I think the moment we have to realize a few things, right? Number one is epi models are not very, honestly, very good in the sense that they do not factor in human response function. And we talked about network effects and so on, so I won't belabor the point. But the real important aspect that we haven't really talked about is unintended consequences, right? Of all this modeling and of all this behavioral analysis that we do, there are a lot of unintended consequences on health, on morbidity, on food chain. Our food chains, like many other developing countries, is labor intensive, right? Our economy is informal. Disease burden is much higher. For TB or childhood diarrhea even, you need regular checkups. So what's happening in a lockdown in those circumstances? And, quite frankly, we also are doing some phone surveys on economic, vulnerability and food insecurity and trying to overlay that on our lockdowns, right? What are we learning from manga? UC manga, you asked a lot earlier. Are we really using other data sets, other ways of understanding what the problems people are facing? I'll give you an example. We have a sample of day laborers, and we wanted to do a resurvey of those day laborers. The situation is so bad कि उन्होंने अपने phone के phone balances khatam kar diye. How are you going to reach those people, right? There are exclusion errors in terms of when you provide whatever type of cash transfers or whatever you do, there are exclusion errors. I would actually wish that all data that we publish, we include standard errors into it, because quite frankly, that will tell a whole different story. We talked about census blocks and other things. Quite एक messaging है, एक बड़ा अच्छा moment है हमारे पास of really establishing social contract in this country. We have to view it from that perspective, and one of the most important things is to establish trust, right? Unfortunately, a lot of times we have trust deficits, whether they are between provinces, whether they are between communities, whether they are between individuals. We have a lot of data that Rajesh Saab also talked about, Duray Sahiba and Haris, कि जी census blocks hai hamare paas. We haven't even released the 2017 census, right? To make data public, data is the only commodity on earth that increases in value with use, and we have an unhealthy relationship with data, quite frankly. So I think we have to step up. We have to take advantage कि जी इस वक्त हमारी messaging, हमारा data collection, हमारी हर चीज जो है वो उस motivation, उस social norm से tied है, उस value से tied है, जो हारिस साहब ने बहुत eloquently describe किया था कि that should be the driver, and we have to ultimately understand that lockdown is not there just for the sake of it. Lockdown is there to balance a lot of different challenges. On one end, आप disease को prevent करना चाहते हैं, दूसरी तरफ आप economic vulnerability को contain करना चाहते हैं, क्योंकि there are people who don't have the means to absorb this shock. एक बात पे थोड़ा सा मैं disagree करूँगा, which is कि I think this will there are structural hits to the economy globally as well as locally. It will take a while to recover from it. And so our approach on this is not just कि immediate हमें क्या करना चाहिए policy, बल्कि sustained level पे हमें क्या करना चाहिए. And maybe that's an opportunity to build systems that are really data driven, or policies that are evidence driven, and let all ideas come together. I mean, it's a moment where we all have to unite. But the factor is that maybe this is an opportunity to build systems and improve systems moving forward.
I think that that represents a really positive way of bringing the conversation towards its close. I must thank all of you. At least two of you had been, I knew had other things and wanted to finish much earlier than we have. We usually go about between 60 and 90 minutes, and we've used up most of that that block of time. I wanted to ask Tanya, who I know is at the NCOC, and therefore there's a lot of things happening there. And so I wanted to ask if she had anything final to add. Otherwise, Tanya?
Yep, I am here. I've actually now stepped out of the NCOC, hence my camera is off. Look, I agree with a lot of what has just been said. I particularly want to, plus one what Maruf just said about our relationship with data in general at the country, and what massive room for improvement we have, because ultimately hoarding data has never helped anyone. And so I think this gives us an opportunity to really try to change the way we do things. And I fully agree with you in that being tactical at this point, like while most of us do end up getting in that mode, I think this is a perfect opportunity to take a step back and to think about building systems that will last, because COVID is what we're facing today. We don't know what is coming in the future, and I think it's incredibly important that we think about building redundancy and building systems that sort of help us be better prepared in the future. So, I don't disagree with you. Don't disagree with you on communication being more coherent. I'm not a communication expert. Also, I think the point on trust deficit was, I'm not sure who mentioned that, but very accurately said and put. My hope is that 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 we continue to get more direct feedback from all of you, even if it isn't done sort of formally. Please continue to do it informally, because there are many of us that are philosophically extremely aligned to pretty much everything that was discussed today. So give us a shout, and it's a long journey. Hopefully we can all be on it together. But thank you for having us.
Thank you for being so open, Tanya. And once again, Langreal Saab, special thanks to you, given the importance of everything that you've said and the way in which you've helped all of us. I think, if I might speak for Dure and Haris and Maruf, in a sense, you've helped consolidate and bring together this kind of this conversation. I hope that we'll add more voices to it over the coming days and weeks. But most of all, I hope that our work and our conversations will contribute to more empowered decision makers and leaders like Tanya and her colleagues in and around cabinet, and better outcomes for the people that need them most, which I know is the motivation for the work that all of us do. So with sincere gratitude for your time and your energy and your integrity and your intellect, until now, but as we move forward as well. Thanks once again for joining us. Hope this was useful for everyone.
Thank you, Musharraf, for having us.
Thank you so much.